Hi, this is Dr. Gary Spears for Arvada Sport and Spine Group. Today we're going to talk a little bit about dry needling as well as acupuncture. We're going to try and ease some of the apprehensiveness that you might have about needles and about what we're going to be doing with them during each of these types of treatments. So I'm going to show you some needles and we're going to talk about how the actual technique goes. Okay? So I'm going to put the camera down here a little bit. First of all, let me show you an acupuncture needle. This is an inch-long acupuncture needle. It is a very thin wire, about 0.20 millimeters. Okay. It is a wire that's woven on itself up here in order to produce the handle. So this is one wire. This is not a pressed on handle. Okay. This is sterile. It's sterilized with ethyl oxide, and they come in this little bubble wrap. So each one of them is sterile and it's never been used more than what we're going to do today. Okay, it's never been used. So what happens is we use these little pipettes. It comes in a little pipette. We tap the end of it and we insert it into the acupuncture point and we leave it there for up to 30 minutes. Okay. We use another size needle. We use a 1/2-inch needle sometimes. That's this one. Okay. Very small needle. We use these for points, for instance, in the wrist or the hands or the feet, sometimes in the jaw or other areas of the neck where we don't need a bigger needle. Now, for trigger point dry needling, we'll use another needle. This is a 30 millimeter needle. Again, it's a 0.20 or 0.25 thickness. Okay. The difference is it does have a handle, and what we do is we'll use the pipette. We will tap the end of the pipette, insert the needle into the skin. We'll remove the pipette, and then we'll stimulate the trigger point. Okay. Then we'll take the needle out, and then we'll go to the next trigger point. We'll find the next trigger point and we'll insert again. We don't leave these needles in. Okay. That's the main difference there between needling with acupuncture purpose and with a trigger point dry needling purpose. This is a little larger needle. We also have a needle like this. This is a 60 millimeter needle. Sometimes, for instance, trigger points in the buttocks, we need a little longer needle in order to get into the muscle that we need to reach. Lots of different layers, up to 7 layers of muscles in the back and the butt. So here you have it. Hopefully that will ease some of your apprehensiveness regarding dry needling. Give us a call if you need some treatment regarding acupuncture or some trigger point dry needling. Thank you.